Are you ready to take control of your health without relying on medication? We're talking about managing your blood pressure naturally. High blood pressure or hypertension is a serious condition. But the good news is that you have more power over it than you might think. Throughout this video, we're going to explore practical, actionable steps you can take to lower your blood pressure without depending solely on pills. We'll delve into lifestyle modifications, dietary changes, and stress management techniques that can make a significant difference in your overall health and well-being. Remember, this information is for educational purposes and shouldn't replace the guidance of your doctor. Now, let's embark on this journey towards mastering your blood pressure naturally. Let's start with the foundation of good health. Maintaining a healthy weight, carrying around extra pounds puts additional strain on your heart and blood vessels, directly contributing to high blood pressure. Think of it like this. Each pound of excess weight is like adding an extra foot of blood vessels for your heart to pump blood through. The more weight you lose, the less work your heart has to do, and the lower your blood pressure will go. Even a small amount of weight loss, just 5% to 10% of your body weight, can make a big difference. That's about 10 to 20 pounds for a 200-pound person. It's not about drastic measures, but about making sustainable changes that you can stick with for the long haul. Regular physical activity is one of the most powerful tools you have to lower your blood pressure. When you engage in physical activity, your heart gets stronger and more efficient at pumping blood. This means your heart doesn't have to work as hard to pump the same amount of blood, leading to lower blood pressure. Aim for at least 30 minutes of moderate intensity exercise most days of the week. That could be brisk walking, jogging, swimming, cycling, dancing, anything that gets your heart rate up. And remember, it doesn't have to be all at once. Even breaking it up into 10-minute intervals throughout the day can be beneficial. Most of us consume far more sodium than our bodies need, and this excess sodium can wreak havoc on our blood pressure. Sodium causes your body to retain water, which increases the volume of blood in your blood vessels, putting more pressure on your artery walls. Aim to reduce your sodium intake. Start by reading food labels carefully and choosing low-sodium options. Cook more meals at home so you can control the amount of salt added, and flavor your food with herbs, spices, and other sodium-free seasonings instead of relying on the salt shaker. If you enjoy an occasional alcoholic drink, you might be wondering how it affects your blood pressure. While moderate alcohol consumption might have some health benefits, excessive drinking can definitely raise your blood pressure. For men, that means no more than 2 drinks per day, and for women, no more than 1 drink per day, or none at all. If you have high blood pressure, it's always a good idea to talk to your doctor about what's considered a safe amount of alcohol for you. We all know smoking is bad for our health, but did you know it's also a major contributor to high blood pressure? Cigarette smoke contains nicotine, which is a vasoconstrictor, meaning it causes your blood vessels to narrow. This narrowing increases your blood pressure and makes your heart work harder. Quitting smoking is one of the best things you can do for your heart health and your overall health. It's never too late to quit, and there are many resources available to help you kick the habit for good. Talk to your doctor about smoking cessation programs or medications that can make quitting easier. A healthy diet is the cornerstone of good health, and it plays a vital role in managing your blood pressure. Focus on eating a balanced diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats. These foods are naturally lower in sodium, saturated fat, and cholesterol, all of which can contribute to high blood pressure. Fruits and vegetables are particularly important because they're packed with potassium, which helps to lower blood pressure. Aim to fill half your plate with fruits and vegetables at every meal, and choose whole grains over refined grains whenever possible. When it comes to managing blood pressure, most people don't realize that sleep is just as important as diet and exercise. When you don't get enough sleep, your body produces more of the stress hormone cortisol, which can raise your blood pressure. Aim for 7 to 9 hours of quality sleep each night. Establish a regular sleep schedule, create a relaxing bedtime routine, and make sure your bedroom is cool, dark, and quiet. Thanks you for taking the time to gain such wisdom. Please like this video as you discover more. Avoid caffeine and alcohol before bed, and put away electronic devices at least an hour before bedtime to improve the quality of your sleep. In today's fast-paced world, stress is unavoidable, but chronic stress can take a toll on your health, including your blood pressure. When you're stressed, your body releases hormones that cause your heart to beat faster and your blood vessels to constrict, leading to a temporary spike in blood pressure. Over time, this constant stress response can damage your blood vessels and increase your risk of heart disease. Find healthy ways to manage stress, such as exercise, yoga, meditation, deep breathing, or spending time in nature. These activities can help you relax, lower your blood pressure, and improve your overall well-being. Monitoring your blood pressure at home is a simple yet powerful way to stay on top of your health. Home blood pressure monitors are readily available and easy to use, allowing you to track your numbers between doctor's appointments. Keeping a record of your blood pressure readings can help you and your doctor identify any patterns or potential issues early on. In addition to home monitoring, be sure to schedule regular checkups with your doctor. They can assess your overall health, monitor your blood pressure, and make any necessary adjustments to your treatment plan. Making lifestyle changes can be challenging, but it's much easier when you have support. Talk to your family and friends about your goals and ask for their encouragement. Join a support group or online community where you can connect with others who are also working to improve their heart health. Having a support system can provide you with motivation, accountability, and a sense of community as you make these positive changes. Remember, you don't have to do this alone. For many of us, that morning cup of coffee is essential to get going. But if you're watching your blood pressure, it's important to be mindful of your caffeine intake. Caffeine can cause a temporary but dramatic increase in blood pressure, even in people without hypertension. While the exact mechanism is still being studied, caffeine seems to temporarily block hormones that widen your arteries. If you're sensitive to caffeine, consider limiting your intake or choosing decaffeinated options. And remember, caffeine isn't just in coffee, it's also found in tea, soda, energy drinks, and chocolate. We all have a sweet tooth, but consuming too much added sugar can have a negative impact on your blood pressure. Studies have shown that a diet high in added sugar can lead to weight gain, insulin resistance, and an increased risk of high blood pressure. Refined carbohydrates like white bread, white rice, and processed snacks can also cause your blood sugar to spike, which can negatively impact blood pressure. Be mindful of your sugar intake and make an effort to limit sugary drinks, processed snacks, and foods high in added sugar. Choose whole, unprocessed foods whenever possible to keep your blood sugar stable and your blood pressure in check. Meditation and deep breathing exercises are powerful tools for reducing stress and lowering blood pressure. These practices engage the parasympathetic nervous system, which is responsible for the body's rest and digest response. By activating this system, you counteract the stress response, which slows your heart rate, relaxes your blood vessels, and lowers your blood pressure. Even a few minutes of meditation or deep breathing each day can make a difference. Find a quiet space, close your eyes, and focus on your breath. Inhale slowly and deeply, hold for a few seconds, and exhale slowly and completely. Thank you for tuning in and taking a step towards a healthier you. Remember, lowering your blood pressure naturally is a journey, not a destination. Incorporate these lifestyle changes gradually and celebrate your progress along the way. Every small step you take makes a difference. Please like, comment, and share this video with your loved ones. Don't forget to subscribe and follow Leroy A. Brown at leroyabrown.ca for more insights on living a healthier, happier life.